There will be links down in the description below this video for articles that you can read more about any of the topics that I talk about in this video. Pressure ulcers is an injury to the skin and underlying tissue resulting from prolonged pressure on the skin. Over 60,000 people die each year from having a pressure ulcer, and 95% of these pressure ulcers are preventable. There are 4 main stages to a pressure sore, but before we get into the stages, the first kind of stage is suspected, and this can be that the skin is red, purple, or kind of a maroon color. If you see this sign, you want to try and take care of it, but the first stage we have is stage 1. In stage 1, the skin is not broken, but the skin does appear red, so that's a sign to look for. In stage 2, the epidermis, which is the outer layer of skin, and the dermis, which is the underlying layer of skin, is damaged. The pressure sore is shallow, which is good, so that means it's not real deep, and it is a pinkish red color. Stage 1 and 2 pressure sores can be taken care of relatively easily. Stage 3 pressure sores, the pressure sore is now a deep wound. There may be fat exposed, and the pressure sore is kind of crater-like. The bottom of the wound could be yellowish or contain dead tissue, and the damage is beyond the primary wound below the healthy skin, and a stage 3 is normally a darker color, so a purple or maroon. Stage 4 pressure sores, which is the last stage, has a large scale of lost tissue. Stage 4 pressure sores may expose muscle, bone, or tissue, and the bottom of the wound is also likely yellow, dark, crusty color, and more than likely contains dead tissue. The damage extends beyond the primary wound below the layers of the healthy skin, and this stage 4 pressure sore is also purple or maroon. Any of these pressure sores could be considered unstageable if the surface is covered with yellow, brown, black, dead tissue, and if it is not possible to see how deep the wound is. If you don't see the pressure sore getting any better, within 24 to 48 hours you should contact a doctor. Stage 1 and 2 pressure sores can be healed without surgery, but stages 3 and 4 may require some kind of flap surgery. Common sites of pressure sores include the back of the head or the ears, shoulders, elbows, hips, lower back, and buttocks, inner knees, or heels. 70% of pressure sores occur on the hips and buttocks, 15 to 20% occur in the lower extremities, and 70 to 90% are normally shallow or near the surface, so stage 1 or 2 pressure sore. Signs and symptoms to look for is a light red, so like a pink or red or purple color of the skin, or if the skin looks irritated, or the skin doesn't lighten whenever you touch it. The skin could be tender or painful, or it could also be more firm or soft than the other parts of your skin on your body. And lastly, it could be a cool or warm touch whenever you touch it. There are 3 main ways to prevent getting pressure sores. Number 1 being doing pressure reliefs every 15 to 30 minutes while you're in the chair, and you want to do these pressure reliefs for about 30 to 90 seconds a piece. The second way to prevent pressure sores is to get some kind of protectant cream, and this here is A+D Prevent, and it is an ointment that helps prevent and treat diaper rash, and it forms a protective barrier to help seal out wetness. So you can get that right there, A+D Prevent, and you should be able to find it at a local drugstore or online. The third and final way to prevent getting a pressure sore is to make sure that you keep your skin nice and clean. There are several ways to cure or treat pressure sores. The first one is to obviously stay off the area where the pressure sore is occurring. So you do want to try and prevent putting any pressure on that area as much as possible. The way to do this is to do pressure reliefs. So if you're in your chair, you want to do a pressure release every 15 minutes, and if you're in bed, you want to do it every 2 hours. If you have a pressure sore, you want to make sure to keep the area clean and just use soap and water to wash the area and around the area. Another thing that you can do is dressing, which heals the pressure sore by staying moist, and it creates a barrier against infection, and you want to make sure you keep the surrounding skin dry. If you have a pressure sore, you can also use moisturizer or a barrier cream, and this right here is another A+D product, and this is to treat the pressure sore if you have one, whereas the other was to prevent it, and it says it helps treat and calm diaper rash and allows the skin to heal naturally. And another thing that I use is this right here, Calazyme, and you can find this at any drugstore as well as the other two. Stage 1 and 2 pressure sores usually heal in a few weeks or a month, probably at the most. But if you have a stage 3 or stage 4, it's definitely going to take several months and maybe up to a year, possibly a couple years. And you also might have to have flap reconstruction, which basically they take muscle and skin from other parts of your body, or make it themselves and try to cover up and heal the area. So those are the main ways to cure or treat pressure sores. But another thing that you can do is take antibiotics, and this helps if you have infection in the pressure sore. Another thing that you can do is change your diet and be sure to drink plenty of fluids, eat foods that is high in proteins as well as vitamins or minerals. If you have a pressure sore, you want to be sure to stay on a scheduled urinary catheterization as well as a bowel program. If you don't stay on a scheduled urinary catheterization or bowel program, it could cause an excess of moisture and bacteria on the skin. You want to be careful with muscle spasms, so take something like baclofen, which is what I take, and it is a muscle relaxer. You want to be careful with muscle spasms because it could create friction or shearing, which can cause or worsen the sores. Another way to cure or treat pressure sores is by negative pressure wound therapy, which is basically a dressing on the sore that is hooked up to a vacuum, and they do something really complicated with it, but it should help. Complications or results of having a pressure sore could be sepsis, which is bacteria in the bloodstream, cellulitis, which is an infection of the skin and connected soft tissue, and lastly is bone and joint infections, which is basically an infection from the pressure sore, can actually cause your joints and bones to get infected because it burrows itself into them. Apparently, pressure sores can also cause cancer. So pressure sores can be really serious and should be taken care of as quickly as possible, and you want to make sure that you're doing everything right. If you guys have any experiences with pressure sores or have any questions, be sure to leave a comment down below.